from pressure to power, how to control your high blood pressure and reclaim your health. The rationale for this one is high blood pressure, hypertension, high blood pressure is super important in our community. It is a condition that makes a lot of other conditions worse. So if you got heart issues, it makes it worse. If you got kidney issues, it makes it worse. It's a leading cause of stroke, and it affects our community disproportionately. In terms of prevalence, approximately 58% of Black adults in the United States have high blood pressure, which is one of the highest rates in the world. That means that if there are 10 people in the room, almost 6 of them people meet the criteria for having high blood pressure. And it's especially important for African American men. The thing about high blood pressure, and this is what makes it so tricky, and that is that you cannot feel vast majority of high blood pressure. If your blood pressure is high enough that you feel it, oh, I got headaches, oh, my vision is blurry, oh, my chest hurts, oh, like this, that's a symptomatic hypertension, is what we call hypertensive emergency. You need to go to ER. They need to get that blood pressure down, get under control. But that's not majority of it. Majority of people have high blood pressure, extremely high blood pressure, and you do not feel it. You're walking around with blood pressure of 190 over 100. You're walking around with a blood pressure of 180 over 95. You're not going to feel it. But just because you can't feel it doesn't mean that it's not causing problems, because it is. These elevated blood pressure readings are linked to stroke, are linked to heart failure, are linked to kidney failure. There's tons of data out there that tells you that as the number goes up, your chances of having end organ damage goes up with it. But unfortunately, because you cannot feel it, most people don't have an indication to treat that high blood pressure. So you can walk around with this stuff for a year, 10 years, 20 years. It's causing the damage, but you don't feel it. It's silent. It's silent like a ninja. It's taking out your kidney, it's taking out your heart. But you won't feel it until you're trying to do something one day, and all of a sudden, you can't move this arm, or you talking to somebody and like, hey, why is your face drooping? It's because you got a stroke, you got high blood pressure, you've been having it for 20 years. This is one of the reasons why we want to talk about it, because it affects people. It's really kind of crisis level, and it's easy to ignore because you don't feel it. A lot of times, once they get in the hospital for some other reason, they'll notice it then, but they may have had it for years. Like I said, sometimes I've seen multiple people that they'll come in with, like I said, of course, I'm a kidney doctor, so of course I see it more so with the kidney issues. At first, they'll say, no, I didn't know anything about it. But most people have known about it for a while. Like I said, it may have been 10 years ago that you went for a physical and somebody noticed your blood pressure is a little elevated, and you said, hey, follow up. There's no connection between that and the actual establishing with a medical clinician, a physician, to take care of that. You don't feel anything. But most people, when you really ask them, they knew. They just put it off.